Good morning, everybody. So I'm Dave McKeag. I'm the EVP of Corporate Affairs and CFO here at HHS. I've been asked to jump in as MC again today, so I'm afraid you'll have to do without the professional sounds of Aaron Level this morning. We do have a really jam-packed agenda, lots to cover. As always, we want to make sure there's time for questions and celebrations at the end. Also, we're going to, as always, do our very best to answer all of your questions in real time if you use the Q&A function. The panelists will respond to your questions in writing. We always capture those and ensure that we update any materials like FAQs and materials on the hub so that all of that knowledge gets shared with everybody. So Sharon is going to speak to us first about the operational update. Before I hand it over to Sharon, it just can't be said enough, I guess. I just would really like to offer sincere thanks for all your extraordinary efforts to care for our patients, to those that are helping behind the scenes, but most importantly, those that are at the front lines. And in particular, I suspect I speak for everybody here, but the protests that are occurring, in Ontario and across Canada, and somehow irrationally targeting hospitals and healthcare, workers, it's just very senseless. It's irrational. It's that kind of reckless behavior has no place in our community and specifically near our hospitals. So we're very aware of that and very empathetic to our own staff, team, and patients as well. And we'll continue to monitor the situation as it may or may not develop and be prepared to support our staff. So anyway, your continued focus on the safety of our patients, families, and each other is really sincerely appreciated. Okay, so with that, I will hand it over to Sharon, who will give us her operational update. Over to you, Sharon.
Hi, thanks. Thanks, Dave, and welcome everyone. And sending regards from Rob, who unfortunately could not be with us today. He has an obligation with the province. So we'll begin today, as we usually do, with our land acknowledgement. We are privileged to provide care on the lands that Indigenous peoples have called home for thousands of years. We recognize and respect the presence and stewardship of all Indigenous peoples as keepers of this land. So today's agenda, as Dave has referenced, as I think we do every week, is jam-packed. I just want to call out a couple of items on the agenda. If you look at our second last agenda item, we'll be talking today about September 30th being Orange Shirt Day and Canada's first National Day of Truth and Reconciliation. And Tiffany and her team are going to talk in detail about that later on in the agenda. I would ask that you, if you have the time, you take the time to check out the hub. The Human Rights and Inclusion team have posted resources regarding the residential school and the history and legacy regarding the schools, and really important that we all take the time to read that materials and inform ourselves. So more to come on that from Tiffany. Also, we're going to get an update on our project Odyssey, which at this point is a mere 200 and some, and I think Barry will refresh us to the exact number, days away, and very rapidly becoming a reality, which is wonderful for HHS. We'll focus on our regular items with our epidemiology update from Dominic, and of course we'll have an extensive update on the mandatory vaccination policy and reporting. But before we move on to other items and before I talk further about the details of the operations, I too would like to extend a sincere thanks to everyone doing everything possible to maintain access to care and services across all of our sites. I know it's been constant. We have been battling this for quite a while now, and we have a very finite health human resource pool right now as exists nationally and internationally that continue to challenge our hospital. While we have a fewer number of patients with wave 3, our clinicians will tell us that these are much sicker patients and much younger patients that we are seeing. And sadly, the majority are also unvaccinated. And many of these unvaccinated individuals are ending up in our ICUs and on ECMO, and we've referenced ECMO previously. We are only one of 4 centers providing this very intense critical care, but it's not without impact. It is resource intensive, it impacts our bed capacity, and it impacts our health human resource capacity and draws heavily on those resources. And I'm sure many of you have seen on social media or on the news that we did have to cancel care last week because of the demands on our critical care services. We have the ECMO demands, we have health human resource pressures, and we also have our regular regional responsibilities that we are trying to ensure that we meet. So we did need to reschedule some patients. I do want to ensure you that we do not take the decisions lightly, and we are doing everything possible to minimize those disruptions and of course reschedule those individuals. A lot of work is occurring by many individuals within the organization and also outside the organization in order to respond to the pandemic, both for the adult population and for the pediatric population, which is also so significantly impacted in this wave. And I would not want to forget our congregate setting partners and our community partners and the intensive work that continues across the entire sector of the healthcare system to battle this fourth wave. I do just also want to remind people about HHS's vaccination management policy that has been implemented. Vaccination is key to ending this pandemic, and that is a message we will continue to emphasize. If you have not been fully vaccinated, please do. If you have not been, you are required to participate in an educational session and self-test every Monday and Thursday, and we'll talk more about that later. We would ask that you report your vaccination as soon as possible if you haven't already done so, and please get vaccinated. I'll move on to the specifics of my regular operational update. And occupancy pressures that I report on each week seem to be increasing each week. We are consistently above 100%. We reached above 110% at some of our acute sites this week. I also do not want to not acknowledge the pressures that we have at our McMaster site as well. Significant pressures with our pediatric population. You can see our babies in the NICU at 100% occupancy, women's health critical care 100% occupancy in our PICU. So these strains across the continuum are with adults and certainly with our children as well. When we look at our ED activity, we are back to our 2019 volumes. We saw a significant dip in 2020 in the midst of wave 3, but we have now returned to very significant volumes across all of our sites. And this is a trend we're seeing across the province. And again, a trend that we're seeing nationally is lots of visits to the emergency department. We do see a slight rise in our ALC rate, which we are expecting to see. It is a sector that is also pressured for health human resources, along with finite bedded capacity. And our surgical activity, I do think it's really important to remind everyone that we are only at 74% of our pre-COVID surgical volumes. So we have not gone back to our pre-pandemic activity levels as of yet. If you could go to the next slide. With respect to the specific numbers, we have 16 CRCI patients in the ICU today. We have 10 ward level, and we have 7 ECMO patients. And I did make a notation there that all of those patients are unvaccinated. Also, in terms of what we're seeing, 90 to 92% of our COVID inpatients have been unvaccinated, and significantly higher in the ICU, and very close to 100% of patients are not vaccinated. So we can see the impact of not getting vaccinated from a public health perspective. In terms of the planning that I referenced in my opening remarks, there is the ongoing review of our COVID care and the staffing models at a HHS corporate level, but also at a site level as well. We have updated our surge plans, and once again, looking at how to extend critical care capacity within our adults and our pediatric sites. We are continuing to discuss the COVID model across Ontario West. If you recall, in wave 3, there were designated COVID sites with HHS hosting 2 of those sites, the Juravinski and the General. So those discussions continue. We are daily having discussions with London Health Sciences in Ontario West. They are the other provider of the ECMO intervention. So we do talk daily to ensure we can balance the pressures across both of our sites. We both host cardiac surgical programs as well, and the ECMO program does work in tandem with that service. We continue to pursue strategies. We would not want to forget that we have a hospital in the satellite health facility with 90 beds. We continue to look at strategies to increase capacity there. And again, complex planning across the region and the province underway for adults and pediatrics. So happy to take questions about our operations later on, but with that, I'll pass it back to Dave.
Thanks, Sharon, and thanks for the update on all of the pressure still facing our system as we navigate through wave 4. And I guess on that note, Dr. Dominic Mertz is going to give us an update on wave 4 and hopefully some bright lights that you could share, Dominic, but over to you.
Yeah, thanks, Dave. I think the main bright light will be towards the end, showing again and over again, vaccines make a huge difference. But let's start with what's happening within Canada here. We are sitting at 78 per 100,000 per week cases at this point. You see on the left-hand side the epi curve for Canada, which continues its exponential growth. It looks like it may be slowing down a little bit over the last few days. Obviously, the increase is mostly driven by the provinces in the West, in particular Saskatchewan and Alberta. You also see a lot of red arrows here. That's RT values above 1.1. So that means that the average person infects more than 1.1 people on average. And you can see a lot of red currently also in the Atlantic provinces. While the highest rates we see currently on First Nation reserves with 367 and the Northwest Territories with 328 of the larger provinces, Saskatchewan has the highest rates, currently 241, and Alberta with 233, and both of them are relatively steeply increasing. Compared to that, Ontario sits at 34. I think in the meantime, Manitoba is actually higher than Ontario. This is data from a couple of days ago. We have a slow growth at this point in Ontario, and our RT is hovering up and down around 1. Next slide. And this is how it looks like when you're looking at the Ontario epi curve. It's quite stable over the last 3 weeks, and this week doesn't seem to be any different. We saw a drop last week. This week we might be slightly higher by the end of the week again. So we continue to be in the range that we had been beginning of October last week. So a few weeks ahead, but the plateau that we now see is something we haven't seen last year. Next slide. In terms of hospital admissions, we are higher at the provincial level than October last year. You can see comparable to November 2020, but you also see that over a month now, or the 4th week in a row, that hospitalization numbers remain relatively stable. Again, not surprising given that the case numbers remain more or less stable as well. Next slide. That's the Hamilton situations. And as you know, over the last 3-4 weeks, we kept telling you, well, Hamilton had a relatively steep rise in case numbers, much steeper than most of the province. Here you see the good news story. We are at half the rates that we had been a couple of weeks ago. Still comparable in terms of case numbers to November 2020, but certainly better than where we had been a couple of weeks ago. Next slide. The other good news story is this here, which shows you the percentage acquisition among those people who test positive. And you can see that close contact again now is the most common source. So, but which means that in half of the cases, or more than half of the cases, actually, when you include the outbreak-related cases, we know who the source was, which means that there's less unknown spread out in the community in the past. A few weeks ago, I would have told you most cases, public health doesn't know what the source was. So those community cases were responsible for the majority of transmissions. Next slide. And this has an impact that's even more pronounced when you're looking at only those unlinked cases, so those community cases which we are using for our policy decisions. And you can see that over the last few days, we are back in the green zone. Now, we will not change the policies back to low epi at this point of time because we don't expect that we will necessarily remain that low, but it's certainly reassuring that it looks like we have a first wavelet, wave 4A behind us locally. The bad news is when we're talking about the wave and look at the more important outcomes, hospital admissions in particular from a healthcare perspective, it doesn't look as great or not yet. On the next slide, you would see that. Again, you see a picture that over the last month, our number of hospitalized patients with COVID-19 within the city of Hamilton remained quite stable. We had that significant increase from 1 week to the next where numbers doubled, but ever since it's relatively stable, and in terms of ICU admissions, it seems like it may be trending down at this point. However, all of this is comparable to where we've been in December last year. And the hope clearly is now that with the case numbers coming down, we would expect that hospital admission should be coming down over the next week or two as well. Next slide. The models. The latest ones that we have from the province are from September 1st. You see that wide range from the best case scenario where a 25% decrease in transmission was assumed all the way to the brownish line, which is the worst case scenario that was considered plausible with a 25% increase in transmission. You see we are somewhere in between, had been following the green line. Now it seems to be picking up again a little bit, but we are certainly not following the worst case scenario at this point. So that's certainly reassuring. We are much closer to green than the brown line. But as I mentioned previously, what you see on this here is first and foremost, there's an awful lot of uncertainty how this fourth wave will continue to evolve. Next slide. In terms of ICU, you see that we have pretty much stabilized over the last few weeks, continue to be below 20. So actually even better than the best case scenario here so far. So again, a good news story for now. Next slide. When we talk about hospital admission, ICU admission, it's important to look at this data as well. This shows you with the brown red line here, number of cases, hospital admissions, ICU admissions on the right-hand side among unvaccinated individuals. So that would be everyone not considered fully vaccinated, which would be 2 doses plus the 2 weeks. If you have the 2 doses plus the 2 weeks, despite the fact that that's the majority of individuals in Ontario at this point, you see very few of those either in the ICU or in hospital, and even among cases, they are 10 times less likely in terms of their relative risk, that is. So what this data basically means is that if you're unvaccinated, you have a 44 times higher risk to end up in the ICU than if you're fully vaxxed, 23 times higher risk to end up in hospital than if you were fully vaxxed, and a roughly 10 times higher risk to have a positive test than if you were fully vaxxed. So again, confirming real world data here in Ontario, the vaccines work as well as everywhere else on this world. Just get vaccinated, please. And this will prevent further strain on our healthcare system. I think that was my last slide. No, we go to vaccines. I forgot about that. So just in terms of percentage vaccinated at this point, you would see here 84.6% of our 12 plus have had at least 1 dose, 78.4% had 2 doses. On the next slide, you see the comparison to Hamilton. And again, that's not a good news story. We are still lacking behind. We have a 3.1% lower first dose vaccination rate. And on the next slide, you will see 4% less in fully vaxxed. We are catching up with fully vaxxed. That's the good news, but very, very slowly. Next slide. And this is how Hamilton compares to the other public health units. And I added those two black lines here. The lower line is the fully vaxxed. The upper line is the single vaxxed. We are not dead last in the province, but we are among the 5 least vaccinated public health units. So there's still a lot of work to frame it in a positive way. There's lots of room for improvement within the city of Hamilton to get our vaccination rates up. As I said, we vaccinate slightly higher at this point than the province on average, but we are not catching up quickly. Next slide. This is what you see here, the 7-day average of vaccines administered. We may see a little blip this week compared to previous, but you see the overall trend is still going towards lower number of new vaccinated individuals each day. We are still administering more second doses than first doses, and what we would have hoped to happen is that the first doses will increase again, but we haven't really seen that, unfortunately. So again, lots of room for improvement if we want to protect our healthcare system from what may happen going into fall and winter. It is to get more people vaccinated, and just repeating it, if you haven't, please do so, not only because of policies, to protect yourself. Thank you very much.
Thank you, Dominic, for that walkthrough. As always, very informative and enlightening, and trying to help us foresee what's to come. So we'll keep moving along now. We're going to talk now about the mandatory vaccine policy here at Hamilton Health Sciences, which we are implementing to be fully compliant with Directive number 6 from the province. Some updates now on the mandatory vaccine reporting elements of it. Over to you, Michelle Leroux.
Thanks, Dave. So just the key link for you to be able to review all of the information, how you report, FAQs. We're constantly updating the documents that are here to support our staff, our leaders, our physicians. So please go to the hub and review it. I will walk through, but I'll pause here just to remind everybody that we're still collecting the data on who's reported and vaccinated and validating that data. So thanks to everybody who's reported their vaccination status, and those who haven't, we will be reaching out. If you haven't reported your vaccination status, this is mandatory under the directive and our policy. A few hints to those of you as you go in. If you are an employee, when you go to the link, please log in as an employee, not as a guest. The guest function is for our physicians, and it does take a little bit longer to validate if you go in through the guest function when you're an employee. No need to submit more than once. We have had people who are overly eager, and we're thankful for that have submitted several times. Of course, you do need to resubmit if you're attaching your proof. No need to follow up with the vaccine inbox. We've got a lot of inquiries coming in, and we're doing our very best to triage those. If for some reason there's something that's challenged with your submission, we'll reach out to you. So please don't worry. And if you're unsure if your submission went through, again, we will be reaching out, or you can always contact your leader, and we'll do our best to support you through that. Okay, and on to my next slide. So I think this has already been shared by Dave and by Sharon, but just a reminder again that this is directed by our Chief Medical Officer of Health. We have implemented our policy. HHS and our people must abide by that vaccination policy. This is not optional. We need to be compliant with our directive to protect our staff, our visitors, our patients, our employees. This is compliant with our human rights and other legislation. We again spoke last time at the town hall about the exemptions and that there's processes in place. Again, go to our hub and you will see the processes to follow for the applicable processes for those exemptions for vaccination. We have again seen some anti-vaccination objections. They do not raise a valid reason for an exemption under the provincial directive or other applicable laws. Okay, and on to my, I think, last slide, because I'm going to turn it over soon to my colleague, Susan. We do have a duty to protect our workers from health and safety risks in our workplace. We're following our directive, we're following our policies, and accordingly, HHS will not be liable if an employee experiences an adverse event following vaccination. The policy does have, as I mentioned previously, processes to accommodate individuals with a valid medical exemption. And those processes, again, are noted on the hub. So we thought at this point, we will take some time to kind of walk through in detail some of our testing processes and our education. So with that, I'm going to turn it over to Susan.
Thanks, Michelle. So this is a reminder, I did mention this at our last town hall. So those who are not fully vaccinated will be required to participate in the education session. I've just noticed in the chat line that there are some questions about what fully vaccinated actually means. So just to clarify, fully vaccinated includes having your second dose plus 14 days. So if you are not fully vaccinated, then these requirements do apply. So there is the education module, which is in our e-learning. If you are not fully vaccinated, you don't need to wait for an email from employee health, although those emails are forthcoming if you have not already received one. But you can go into our LMS system and you can search on COVID-19 vaccine, making an informed decision. That's in the slide deck here, and that will take you right to that education module. It'll take you roughly about 10 minutes to go through that module, and again, provides you some good information around the vaccine and the efficacy of it. So for those who have not completed the education by September the 24th, which is the deadline date, if you're not fully vaccinated, the leaders will be receiving a list of those individuals so that they can follow up. Again, just as a reminder, if you've missed it or have forgotten about the requirement to do so. So on to testing. Again, those who are not fully vaccinated, in addition to the education, will be required to complete self-antigen testing at home twice a week, Mondays and Thursdays. And there are specific instructions, I'm going to show you that on the next slide, that are included in with the kit. It's very easy to use. And those instructions will outline what to do if your test comes back as negative. So if your test is negative, then you need to take a photo of that is time-stamped so that we know the date that that photo was taken, and then hold on to that. There will be auditing that's being done by the Employee Health Services, and in fact, the auditing is starting today. That auditing will continue to evolve as we move over the next few weeks. Currently, we've got a small group that have received their test kits, and as each day goes on, we are sending out hundreds of test kits to individuals. If you have a positive test, this gets back to what we talked about earlier, if it's positive or if you're experiencing symptoms of COVID, then you must not come to work and you must follow the procedures that we've had in place by calling Employee Health Services at 42200, and they will provide you with further guidance and refer you to an assessment center for a PCR test. So again, if you do receive an email from Employee Health about the auditing, you will be required to submit your proof, and that auditing process will continue to evolve as we go over the next few weeks. The testing instructions, again, I won't go through this in detail. They're very specific. They're included with each of the test kits that are being mailed out. So if you receive the test kit, please read the instructions that are provided. If you do have any questions, there is an email inbox that's set up specifically for the test kits that you can email any questions to. And then finally, just on the compliance. So again, if you're not fully vaccinated, the education piece and the testing piece applies. If you have not reported, then of course the testing and the education apply. So those who have not reported, or those who are not fully vaccinated but don't follow through with the education and the testing, we will be starting to look at measures for that. Again, that information will go to the managers, and then further discussions will occur from there. So with that, I have sort of outlined everything that is required. Again, if there are any specific questions, please feel free to put them into the Q&A, and I'll do my best to answer them throughout the course of the webinar. And Dave, I'll turn it back over to you.
Thank you, Susan and Michelle, for walking through that. And also thanks to everyone in the organization that's helping to navigate, a rapidly changing policy from the province that we are working very hard to address. So thank you for your support on the floors as well. Now going to move on to hear a little bit about Orange Shirt Day, and that will come from two people, both from Stephanie and Tiffany. So we're starting with Stephanie, so over to you.
Sego scano ani Stephanie Nagaya so Oswega Duagande no Ganyak na Nawaige Shota Gayakono ni wa Quenzede. What I have said to you is my name is Stephanie. I am from Six Nations. Turtle is my clan and Cayuga is my nation. I'm the Indigenous Project Coordinator for the HNHB Regional Cancer Program. And I'm going to give you a little small paragraph about why we use the orange shirt. So the orange shirt in Orange Shirt Day refers to the new t-shirt that Phyllis Webstad was given to her by her grandmother for her first day of school at St. Joseph's Mission Residential School in British Columbia. When Phyllis got to school, they took away her clothes, including her new shirt. It was never returned. The government recently passed legislation to make September 30th a federal statutory holiday called the National Day for Truth and Reconciliation. And I'll pass that over to Tiff now. Thanks.
My apologies, folks. Thank you so much, Stephanie. Taking a moment today to remind the community about Orange Shirt Day calendar that we have posted to the Human Rights and Inclusion Hub page, which features 94 learning opportunities. These learning opportunities have been prepared by our Human Rights and Inclusion team in collaboration with Indigenous staff, physicians, and programs across our organization. We encourage everyone to engage with the learning opportunities captured on the calendar this month. Along with the calendar of learning opportunities, there are a number of date and time specific opportunities this month. So beginning on Monday, September 20th, there will be an online live book launch and learning opportunity with Phyllis Webstad, who Stephanie's just spoken to. This online event will take place from 2 to 3 p.m. and Phyllis will be offering an opportunity for participants to learn from her, members of her family, as they share truth of their residential school experiences through their new book, Beyond the Orange Shirt Story. You can access this event via the link on the slide, and again, featured on the Human Rights and Inclusion team page as well. On Wednesday, September 22nd, from 12 until 1 p.m., you can participate in the Regional Oncology Rounds via Zoom to see an Orange Shirt Day book reading and participate in a learning opportunity and discussion about the Truth and Reconciliation Commission's 94 calls to action. And again, on Thursday, September 23rd, there will be another book reading of Orange Shirt Day. You can join Stephanie and her colleague Dina from our Indigenous Outreach Program from 12:30 to 1 p.m. for a reading of a chapter from Phyllis's book, Orange Shirt Day, September 30th. There will also be time for folks to ask questions. So please do reach out to my Human Rights and Inclusion colleague, Emmeline Gregoroff, to have this calendar invite forwarded to you, and her contact information is there for you. Finally, outside of HHS, we also encourage you to explore the Woodland Cultural Center's programming on September 30th. These programs are available to any member of the public at a cost of $11.25 per person. We know this cost may be prohibitive to some, so this is just a recommendation for folks to consider as you explore the learnings available to you this month. As always, more information is available on our Human Rights and Inclusion page. And with that, I will hand things back to you, Dave.
Thanks to both Stephanie and Tiffany for walking us through that. Something that is coming up very fast, actually. It's hard to believe how quickly the calendar is approaching. So thanks for that reminder. Last, we're going to move over to Dr. Barry Lum, who's going to give us an update on Project Odyssey. I might editorialize for a quick moment as the executive sponsor for Project Odyssey. It's just number one, such a huge effort, and acknowledge all of the effort, both those in the organization and specifically in the project team that are working on that. Also, an incredibly important effort towards safer patient care here at Hamilton Health Sciences, and why we continue to pursue that goal as our other organizations, even amidst the pandemic. So with that, Barry, you have an update for us today.
Thanks, Dave. Hi, everybody. Most of you will have now seen this cartoon a number of times, which outlines our journey through the Odyssey project leading up to our go live, which remains scheduled for June 4th of next year. We are now halfway through the project. We are extremely busy as we keep this moving. And I would like to just comment, as Dave has and others have, that we understand the incredible stress that the organization is under, but we also, I hope, can remind you that this is a critical step in the quality of care and the provider experience for HHS, and it really is incredibly important that we keep moving and turn the corner to make ourselves one of the best digital institutions in the country. Next slide, please. So we continue to count this down. We're now 260 days away from go live. And as I've said over and over again, it is very busy. Next slide. Next slide, please. There we go. You've also probably heard me say over and over again how absolutely critical training is for the success of a go live. But one of the other most important pieces is the support of staff on that Saturday morning as we move into the Epic world and say goodbye forever to Meditech. So the concept of super users are individuals who will literally be at your elbow, at the elbow of our providers at the time of go live. And we continue to need staff to express their interest in this. I can't tell you how important it will be, but I also would like to tell you that for those of you who choose to get involved, I think you'll find it extremely satisfying to be right on the front line, an expert in the Epic world, and able to help your colleagues. If you're not aware, there is an electronic form available on the hub that you can use to submit your expression of interest, and also that will provide you with some more information. Our current deadline is September 24th. I would like to also emphasize that this is a temporary assignment, and that the major time commitment really will not start until April of next year. There will be some training prior to that, but when you really will need to be fully engaged begins in April, and your full-time commitment to this role will start on June the 4th when we go live, and we'll need you there supporting your colleagues and helping us get the system up and running for about 8 weeks after that. Once your form is submitted, the project team will collaborate with your supervisor or your manager to make a final decision. But I want to again emphasize this is an expression of interest. This isn't a final commitment. And so if you think even for a few minutes that this might be something you'd be interested in, please take a moment, have a look on the hub, and give it some consideration to apply. The response so far has been really very good, but we're very keen to get as many of our own internal super users as we possibly can. Next slide, please. There's all kinds of other stuff going on around this place related to Odyssey. I've just mentioned the super user piece. We're in the process also of recruiting credentialed trainers who will be the folks that will train. We will train in the Epic world, and then they will train us. We're in the process of deploying a huge inventory of new devices and hardware, including a complete update of the organization's Wi-Fi. We'll start to begin the process of validating and testing and asking individuals to be involved in that. And then the opportunity to register for training will open up in December. And the last slide, please. So just as always, I would encourage you to go to the hub for any information, or don't hesitate for a moment to reach out to us at odyssey@hhsc.ca for more information. Thanks, Dave.
Thank you, Barry, and for all that you and the team are doing to continue to move that forward. So this time we're able to move to the Q&A portion of the webinar. So as always, you can use your raise hand feature, or people have been typing lots of questions into the Q&A, which is where they should be typed. Alternatively, you can always type an email out to hhsnews@hhsc.ca. And as always can refer to the materials that are continuously updated on the hub as we try to provide information as it evolves. So maybe I will start to ask a couple of questions for folks, panelists that are here. There's been several questions, and I think I would phrase it like this. We are always reliant on the professionalism of all of our staff and positions in the organization as we move into new policy. With that, there's been some questions about, what if I'm aware that a coworker is not complying? What do I do? So maybe I could ask Michelle or Susan if they could comment on that.
Sure, I'll comment. I think for now, what I would suggest is we're just starting our rollout, as Susan mentioned, about auditing those who are either have not yet reported and or have to do the testing and educational components. So I think we need a little bit of time to allow that process to be underway. And then at that point, should we need to have a reporting option, we could reconsider. But I think at this point, just a little bit of time to allow us to reach out and identify those on our own. Because again, it has only really been in place for the last 9 days. But I think more to come in upcoming town halls. Thanks, Dave.
Thank you, Michelle. Another question, a few questions have been coming in, and I don't believe we have Kirsten with us today, but perhaps Dr. Mertz, Dominic, there's some questions about how will this apply to visitors, our requirement to be fully vaccinated for staff and physicians. How will that apply to visitors at HHS? Is that something that you'd be able to help us answer?
All I know at this point is that it's being discussed among or across all hospitals within the region that are trying to come to a agreed upon approach that's the same across the board. That's the latest news I have on this piece, but it's certainly being discussed.
Thank you, Dominic. So as and when information on that becomes available, we'll be sure to share. One question related to EPIC is, will Meditech be replaced for finance and supply chain? Which I guess maybe, that's something that I could answer. So the short answer is no. The EPIC product, as immense and diverse as it is, focuses on clinical care and not on some of those sort of support functions. So those modules in Meditech will be retained and continue, and will be cleanly interfaced, etc. But no, they will stay. Just looking at other questions that are coming in. There's several, just trying to weed through for a moment and see. There are several questions that are coming in around specifics of the testing practice, like the very specifics, like how long do I keep the photograph for? What if it isn't time stamped, etc. So I'll just suggest that as that is rolled out, the materials on the hub will try to answer all of those very specific questions so that it's very clear exactly what you need to do to swab at home. Kelly, I wonder if you wouldn't mind touching on, there's just a different question here. Last week, there was a memo issued about our remote worker policy, and if you could just comment on where that is at.
Yeah, so similar to what we said in the memo last week, stay tuned. Certainly work under development. for a policy for remote work. We have some work to do before we can roll that out, but there's a small working group coming together to talk about the process. So I think staff could expect to hear something in the next few weeks to a month.
Thanks, Kelly. And I think a lot of the questions I think we have actually answered because they're very similar themes. Yeah, no, I think most of these have actually been covered. So like there are several, but as quickly as I'm trying to go through them in real time here, it seems like most of them have been answered or relatively similar question has been answered. So with that, that said though, the team will continue to go through all of the questions. And if I've missed one or two, I apologize. And the team will make sure that we do find them and answer them on the hub as per always. So maybe with that, we could move to celebrations. And you know, it's as I said at the very beginning, at the outset, it's just such a difficult time for everyone working here, and you know, immense thanks. And I have seen so many different teams and people and individuals, you know, rise up for so long, and it's just important that we say thank you, and important if we could call out any specific celebration. So if any of the panelists have something they'd like to say, just come on camera, and if anyone else would like to add something, please put that out there for us to see.
We do have one already. Thanks in the chat, Dave. Celebrating the screening staff at the Hamilton General, thanking them for their exceptional teamwork, willingness to help, and general rallying. Their positivity is contagious and very much appreciated. Thanks for that. It sounds like a very enthusiastic screening group. So thanks very much for that.
Yes, absolutely. Thank you. I see another one here. Congratulations to all who have participated and supported the Bright Run, an event coordinated by staff, patients, and friends at the Juravinski Cancer Center. The event raised, oh, it's jumping around on my screen. It just went away. Well, it raised a lot of money. So thank you very much for those that participated in that.
I can finish that off for you, Dave. The event raised $360,000 for the local breast cancer research. The Bright Run in McMaster University also made the exciting announcement of a new Bright Run research chair. The first chair is Dr. Shaha, I hope I said that right, a computer engineer, oh, now it disappeared on me, computer engineer and a data scientist with expertise in AI. Exciting research with global impact is coming soon. That's phenomenal. Thanks for sharing that.
Very good. And there's another one here. Congrats to the ICU team at the General for accurately depicting the situation in their area to CTV News and showcasing their compassion and professionalism. That was a very well, and clearly demonstrating the need to be vaccinated. I watched that myself this morning, and I thought it was, I echo those comments. So thank you very much for that.
For sure, want to call out Barb Linkert. I say thank you, Magna, and folks will see a share story on Barb as well, our longest serving employee of 55 years here at HHS. And I know I've worked many decades with Barb over the years, and for sure, all of us extend congratulations to Barb.
We do also have, you know, I'll say thank you back for this particular one. We have a thank you for hosting these webinars and being, you know, making ourselves available every week to try to answer questions and keep everyone informed in the face of some challenging situations. So thank you for that comment for the panel. Thank you.
Another thanks for the ongoing support for Strides that everyone's supporting, that will support the General Regional Rehab in St. Peter's. Truly appreciate it. Thanks, Leslie, for that.
And we have a thank you from Rebecca Fleck. September 15th was Rehabilitation Day. Data recognize the life-changing impact of rehab services across the province and HHS. It's such an incredible rehab program that impacts the lives of so many. So thank you to each and every one of our rehab teams for all of your hard work, dedication, and passion for rehab. And absolutely agreed.
Yes, and I just acknowledge Rebecca as a wonderful ambassador for rehab services. She sent out a beautiful message yesterday to the rehab team to acknowledge them for the service. And a thanks to Rebecca for leading that program.
Okay, I don't think I see any additional thank yous coming in. So with that, what we'll do is we'll, as they say, give everybody a few minutes back and we can end today's session. Again, thank you for attending. Thank you for your questions. Your questions help us to provide better information back to everybody in the whole organization. So keep them coming. And with that, thanks for all you do and hope you have a great rest of day.